Professor Richard Watt. Professor Watt is a professor and honorary consultant in dental public health in the Department of Epidemiology and Public Health, UCL. He is the director of the World Health Organization Collaborating Center on Oral Health Inequalities and Public Health. Professor Watt will provide a presentation on leveraging upstream interventions for promotion and prevention.
I'm a bit taller, so I'm going to move the stand. There we go. Thank you very much for the introduction. It's a great honour to address such a distinguished and esteemed audience, so thank you very much for inviting me. And I'd also like to thank our Thai hosts for looking after us in such a profoundly pleasant way, and it's great to be back in Thailand. And lastly, I'd like to thank Benoit and his amazing team for organising us all. So Benoit, Nicole, Eureka, Habib, etc. have done an incredible job to make us all feel part of this unique experience. So thank you very much. So I'm delighted to be in this presentation looking at public health and health promotion opportunities to promote oral health. And I suppose one of my main messages is really to reinforce the issue that looking at health services alone is important, but we must look at the bigger public health picture as well. And what I would like to start my presentation by highlighting is we've heard repeatedly in day one about the burden of diseases globally and also the shocking inequalities that exist in relation to oral health. If we really mean that oral health is part of general health, then we need to reframe our whole discourse around health and look at it as a basic human right. So oral health is not an individual responsibility or a commodity. Oral health is not a luxury for the few. Oral health is a fundamental human right for all, leaving no one behind. Human rights are enshrined in the UN Declaration of Human Rights, the WHO Constitution, and a whole range of national treaties around the world. And very, very importantly, if we consider oral health as a human right, that means that governments have an obligation to respect, protect, and fulfill the human rights of their citizens, which then opens up a whole range of responsibilities for governments and policy agendas. What I would also like to highlight is the evidence on the limitations of traditional preventive approaches. The lamentable failure of lifestyle interventions and the failure of self-regulation is well documented globally. Collectively, we have to acknowledge our failure in tackling the underlying causes of oral diseases. We also have to recognise the dominant neoliberal agenda that has moved across the globe in the last decades that has led to deregulation, greater inequalities amongst different social groups. That neoliberal agenda is part of the problem we have to tackle. Traditional preventive interventions are too individualistic. They're ineffective in terms of reducing inequalities in a sustainable fashion. They only generally achieve short-term benefits for the advantaged in society. And also they can be very costly if they rely upon professional input. But the biggest concern with this traditional preventive approach is the risk of intervention-generated inequalities. So rather than us reducing the health gap, our interventions can actually increase the health gap by inadvertently benefiting the more advantaged and leaving our disadvantaged populations further behind. So what I've been asked to do is to revisit the upstream metaphor. And this image is an image of the upstream metaphor that is produced by some of our postgraduate Thai students, that was produced over 30 years ago. So this image, for some of the people in the room who have studied in London, will be very familiar. But it's actually 50 years since John B. McKinley first coined the metaphor of upstream, downstream. As a New Zealander, he presented at a cardiology conference in the US the notion of upstream interventions. And this Thai image sort of translates it into oral health and oral health disease burdens. So we can see the upstream manufacturers of illness are the factors that cause disease, that are the fundamental drivers in our societies. The midstream factors are our attempts at treatment and resuscitation, and then you can see a little Thai dentist with a dental chair. That downstream approach to treatment fails to stop the flow of new diseases coming down. So this upstream metaphor remains a seminal part of public health learning and teaching. But there's been some contemporary updates to the upstream approach that I think is important to be aware of. So linking beautifully to what we just heard from our WHO colleague on the importance of tackling the commercial determinants of health, what we also must never forget about is the importance of tackling the social determinants of health. So that is the poverty, the discrimination, the exclusion in societies that drive inequalities in both oral health and in general health. We also can recognize the determinants in terms of health systems, and we know in this room how many countries are facing the challenge of improving affordability and access to essential dental care. That again is part of this broader determinants of health. So an upstream approach is trying to tackle the combination of political, social and commercial determinants through policy agendas. And at the essence of that analysis of these determinants is really the sense of looking at power imbalances and the power dynamics and differentials in society that drive these factors. We've just heard now from Dr. Gallian on the commercial determinants. So the neoliberal agenda globally has enabled trans-global corporations to become more and more powerful in their influence on NCDs around the world, including oral health. So the politics of power is the core essence of determinants of health. The next element to consider when we can look at upstream is the nature of the interventions and policies that need to be addressed. So this is an old slide for oral health that looks at the downstream, midstream and upstream interventions. So the downstream, as we know, are the individual level, patient contacts. Now we know the importance of downstream, the need for evidence-based scientific prevention, and across the conference we're hearing more about that importance. However, downstream alone is not sufficient. We also need midstream interventions, and later in this session we're going to hear about the Fit for Health programme. We've got the Child Smile programme in Scotland and elsewhere, where we look at creating healthy settings that enable local populations, whether children, older people, different groups in society, to be in a healthy setting based upon policies developed for that area. And then lastly, we've got the upstream level of policy intervention. And upstream essentially means population-wide. It means looking at regulation, legislation, fiscal pricing policies that can be implemented to create healthier environments that are more sustainable, and particularly importantly, with a pro-equity angle to protect and reduce inequalities in health in those populations. The third area that we can consider upstream interventions is the ways of working to implement upstream policies. And we've heard repeatedly this morning and yesterday the need for transformative approaches. So we need to look at the central importance of advocacy and develop our advocacy skills to enable us to influence and achieve policy change in our communities and nations. Very importantly, and again we've heard this again and again, is the need for meaningful engagement with civil society. Now, our colleagues from the NCD Alliance and other groups have pushed this agenda forward, but I think in oral health, that is one area where we really need far greater emphasis to engage more meaningfully with our communities. And we also need to think about truly multidisciplinary in nature working. And that means whole of government, that means whole of society, implementing health in all policies that are of relevance. It's a holistic approach to multi-sectorial working. The issue of community engagement involvement, I think, is fundamentally important. And these are just some pictures from a project that several of us in this room are currently working on, working across 4 middle-income countries, a project funded by the National Institutes of Health Research in the UK. And what we are doing is embedding this issue of community engagement as a central part of our project. And Rajiv in the back there has been incredibly helpful. We've been working with the Self-Employed Women's Association in India, which is a grassroots community organisation which has enabled us to work with the communities in these different countries, to consult with the community, to discuss their priorities, to engage them around oral health, and eventually to mobilise and empower them to press for change in oral health policies in their community. Now, what we've heard again from our first video presentation is upstream approaches are effective. We've got the evidence on their effectiveness. The best example to illustrate the value of upstream approaches is the experience gained from the WHO Framework Convention on Tobacco Control. That multitude of policies together, collectively, have helped not eradicate tobacco use, there's still major challenges, but have made a significant difference. And very importantly, these upstream policies can be operated in high income, but also in low and middle income countries as well. They are applicable across the globe. And a team of us are just finishing off a review funded by the Barrow Foundation, looking at the public health evidence on upstream interventions, and there's a range of very good examples of upstream policies achieving public health gains. Again, we've heard of the importance of sugar taxation, for example, in sugar-sweetened beverages. And over 110 countries around the world have implemented a sugar taxation policy of different forms. But I think we have to recognise that upstream is not only about sugar-sweetened beverage taxation. As we heard in the video, we need regulations about advertising. We need regulation about improving food labelling. We need legislation about limiting political and lobbying influence on health policy development. There's a whole range of upstream options that we need, and sugar-sweetened taxation is one good example. And just to conclude, myself and several people in this room are members of the Lancet Commission on Oral Health. And one of our beliefs is we'll be publishing the Lancet report in 2025. And in that Lancet report, we'll be advocating for the importance of this upstream approach, this need for meaningful engagement with communities with a strong pro-equity focus. So to conclude, I would want to argue that oral health is a fundamental human right. Current preventive approaches have failed, otherwise we wouldn't be gathered here to address these continuing problems. Upstream policies are part of the solution, to tackle these underlying determinants. And we in this room need to be bold and ambitious in our policy and advocacy work to tackle these drivers of inequalities and disease. And we need to do that with strong, meaningful engagement with civil society. And I want to just end with a statement. I interviewed John McKinley a few months ago, and his interview, he highlighted we need to fight fire with fire. That's the ultimate drive that we need to do. That's our challenge in terms of moving forward. Thank you very much.